Hello, Marcus Boston. Quick video this morning, and I would like to discuss with everyone a frequent question that we got over the holiday break. And that question dealt with, can malpractice cause a baby to suffer a traumatic brain injury during birth? And this is in the context of HIE or hypoxic ischemic encephalopathy. The short answer is, in general, yes, medical malpractice can, in some instances, be the cause of a baby suffering a traumatic brain injury. Now, to be able to know that though, there's things that we have to do. And if you have watched my other videos or if you're on our YouTube page, you know that I talk about this thing called our birth injury investigation. And I'm talking about that because we have to be able to investigate. We have to be able to see what caused it. You know, was it something that the hospital or the doctors or the nurses, something that they did or did not do or did not treat during labor and delivery? Or was it something like genetics? Or was it something like development? Did something happen earlier in the process that caused the baby to suffer an injury? And so it's very important to understand the steps in this process. And when we are doing our investigation, there are a lot of areas that we have to be able to take a look at. And a lot of that can be, you know, doing the electronic fetal heart monitor, looking at those readings, looking at mom's history, and so there's a host of things that we have to take a look at and to be able to get an idea as to what may have caused the baby to suffer the injury. And, I've talked about in other videos, for example, if mom, let's say during labor and delivery, and mom is having a lot of contractions and they're coming quick, maybe they have something to augment labor, so Pitocin or something like that, and maybe there is a condition called tachycecily that's going on. Mom is having too many contractions, not having enough time to rest. If tachycecily is present and it's not treated correctly, or doctors, they don't see it or they don't notice it, nurses, they're not able to recognize this. This could mean in some instances that the baby could be having oxygen-related issues. And so something like that, for example, you're going to want to know, was mom dealing with tachycecily? You're going to want to know, were there late decelerations? You're going to want to know where there were variability issues, minimal variability, or were there absent variability. So the purpose of this video is to help you understand it is a process. There's a lot that we have to take into consideration when we're doing these investigations. But the short answer, coming all the way back around, is yes, in some instances, a baby's traumatic brain injury can be due to malpractice. So maybe you are here today, maybe you're watching this video because your baby has suffered a traumatic brain injury and you have questions. You have this HIE diagnosis and you want to know, well, was the hospital the cause of this? And if they were, or the doctors or the nurses, how are they going to assist you moving forward with the care of your child? Because it's their responsibility. If you're in that situation, you have those types of questions, there's a telephone number on the screen. I invite you to go ahead and pick up the phone and call me. It costs you absolutely nothing to speak with me. There's no charge to talk with me initially about your baby's story. When you call me, just let my secretary know that you'd like to get on my calendar, or my co-counsel, Renee Boston, on her calendar, depending on who's up to do the calls, and we will discuss what you have going on with your child. We talk with families like yours about these types of issues: HIE, CP, cerebral palsy, MAS, shoulder dystocia, host of these types of issues. This is what we do. One more thing before I get out of here for today. I practice law here in the state of Maryland. And if you are not in Maryland, because this video is on the internet and I can't control who's going to watch it and who's going to call, if you're not in Maryland, understand that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something that we can work with you on, but I just want to make sure that you understand, if you're not in Maryland, that you understand that co-counsel or that local counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care and enjoy the rest of your day.